Hi there, my name is Corey Blickenstaff. I'm a physical therapist in Vancouver, Washington. I'm going to take you through a short little routine here that I use a lot for back movements and hip movements. Now, the first thing you want to do is get onto your hands and knees. My knees are about hip width apart, maybe a little wider, but really wherever it's most comfortable, and your hands are underneath your shoulders. And the first movement you're going to do is you're just going to rock up and down with your back like this. Okay? Now, what a lot of people's tendency to do during this movement is going to be to move kind of from in between their shoulder blades. It'll be kind of in their upper back. What you want to do is roll your pelvis forward and backward, more from here. Okay, you want to drive this motion from below and not from above. That will help you to isolate the movement more to the lower back. Okay. Now the second motion is going to be the same idea, except now it's going to be side to side. Now you'll notice I'm, again, kind of moving my hips back and forth, but what I'm not doing is I'm not rocking from side to side with my shoulders. I have to turn them a little bit, and actually you want to kind of dip one shoulder towards the opposite hip. But again, you're trying to drive this motion from below and not from above. What a lot of people who have kind of gotten out of the habit of moving from their spine in a very controlled manner is they drive the motion from above. So by driving the motion from below, you'll set yourself up for this novel movement. Now the next one is you're going to rock back towards your hips, just like this. Okay? Now what a lot of people are familiar with is the prayer stretch, where you let your back arch. That's not what you're trying to do. Notice how my back isn't arching. In fact, I'm trying to keep my back kind of relaxed and down and more sink into my hips. That's where the novelty comes in here. It's pretty common for people to have gotten in a habit where anytime they bend their hips, they also bend their back. Nothing wrong with that, but by breaking up that habit pattern, we again get into a situation where we're doing hopefully a novel movement, something out of our normal daily movement repertoire. Okay? Now the next one, this is the most difficult to coordinate, is you're going to take your back in a circle like so. Okay, now like I said, this is a difficult one for a lot of people to begin with. So what you might need to do is go back to the up and down motion and the side to side motion, and you're going to combine the two. So you'll go down, left, up, right, down. And then you just simply fill in the spaces. Okay, this will get better with practice, but another thing you can do once you've got the coordination of this down is you can kind of alter where in your back this motion is occurring the most, from the biggest focal point. I can bring the focal point higher in my spine, like this, or I can make it lower in my spine, like this. Okay, but again, the benefit of this is that these are movements that are likely out of most people's regular movement repertoire. By expanding your movement repertoire, you're also going to be getting into some novel situations. The benefit of that is that you're doing a movement your body does not yet have an opinion of. Hopefully you can learn to move in some ways that are new to you and do them in a way that your body does not come to an opinion of needing protection. So those are the quadruped movements that I use. I hope you find them helpful.